Hello and welcome to YouTube channel HealthQ, the place where our mission is to not only motivate you but help you to move on to the bright side of the health. In today's video, I'm going to tell you how to reduce the spasticity in the hamstring muscle of a CP child. Now, what is a hamstring muscle? Well, hamstring muscle is a muscle that is lying behind the thigh region, or else the back thigh muscle is a hamstring muscle. The action of this muscle is to make your knee bend. Yes, if you want to bend your knee, you need to activate your hamstring muscles. But sometimes due to dystonia or spasticity, this hamstring muscles gets unnecessarily tight, and due to this tightness, person is not able to make their knee straight. So if you have observed that whenever your child is sitting and the knee stays little bent, does not get straight completely, that could be the sign that the hamstring muscles are tight or spastic. So what you can do in order to reduce the tightness or spasticity of an hamstring region, let's have a look. So consider this is the hamstring muscle of the child. So hamstring muscle lies in the back thigh region. It starts from the hips and goes till the knee. At knee it ends. Usually this muscle is tight in a child who is suffering from cerebral palsy and is having spasticity or dystonia. Now, if we want to reduce the spasticity and dystonia of the child, what we need to do? The first thing that we need to do is we need to relax these thigh muscles. The way to relax this thigh muscle is the first thing by gentle stroking. So before you start any activity, make sure you gently stroke this area of the child. This will calm the child down. If you feel you need to apply little more firm pressure, you can use the palm and then you can gently press the child's hamstring region. So this stroking basically reduces the spasm that is present. After this, the next thing you have to do is you need to do some free movements around the knee region. So you don't need to force anything, just gently, whatever freely you are able to do, just try to do. Do it in a prone position, which means when the child is sleeping on the tummy, or else you can also make the child sleep on the side and then holding the leg gently you can do backward and forward. This is also a good way of doing the activity, but make sure to do that. And after this, the next thing that you need to do in order to reduce the spasticity is stretching of the hamstring muscle. So how do you stretch a hamstring muscle? You need to make the baby or child lie down straight. Now for example, this is the muscle where I need to do the stretching. I will bend the hip 90 degree and knee also 90 degree. First I will bring the child in this position. Again, make sure don't forcefully do this. If child is not allowing this to do, first calm the child down, do some free movement, then you bring the child here. Once this is done, now what you need to do, first you need to bend the knee and make it straight as much as you are able to do freely. Alright. Now, once this is done, then you will raise the knee and make the knee straight. Again, don't force much where it causes pain to the child. This should not make your knee completely straight. Slight straight is enough. Slight bending is fine. 5 degree of bending is fine. Okay, you have to hold this position for 30 counts and then again bend back. Repeat this process for 5 times. 2, 3, 4 and 5. And relax. If you do this daily, you would be able to reduce the spasticity in the hamstring region. I hope you found this video helpful. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.